Hey dear students, we are dealing with pathology lecture of respiratory system. Now we will take lung infection including lung abscess. This is Dr. Shaima Al-Gohari, lecturer of pathology. Our case is about a previously healthy 6-year-old patient underwent urgent operation under general anesthesia. Urgent operation means that the patient is not prepared. Not prepared يعني not in fasting state. Okay. 3 days later, he developed progressive fever and signs of chest infection, followed by laboratory investigation which revealed markedly elevated white blood cell count, followed by chest X-ray which revealed an opaque shadow of right lung mass. Take care, right lung mass which has air fluid level. What's X-ray picture revealed mass in the right lung showing air fluid level. This lesion showed part filled with air and the underlying part showing fluid, which is pus or necrotic material. Air fluid level like a glass partially filled with water and partially containing air with a fluid level in between. Lung abscess defined as a localized area of suppurative inflammation. As we learned previously in the general, there is types of inflammation called acute suppurative inflammation, and acute suppurative inflammation has a localized one, which is abscess. Abscess is containing necrosis, which occur within pulmonary parenchyma, resulting in the formation of one cavity containing this necrotic material or more than one cavity. Okay, causes of lung abscess mostly occur due to what's called aspiration or inhalation lung abscess, followed by localized causes and systemic causes of infection. The most common cause of aspiration lung abscess from oral cavity sepsis like dental sepsis, infection in the sinuses or tonsil, which can occur during oral surgery like extraction of the tooth, oral operation, anesthesia or coma. Okay, aspiration of gastric content, which is very irritative due to the acidity of the gastric juice plus the irritative effect of the food and some bacterial flora from the oropharynx during aspiration. Commonly occur in comatose patient and in anesthesia, urgent anesthesia like urgent operation as in our case. These abscesses are commonly occur in which side, right or left lung? Yes, right lung more due to vertical orientation of the right bronchus with the trachea. And in the right side of the lung, it occurs mostly in the posterior segment of the upper lobe or apical segment of the lower lobe due to the recumbent position of the comatose or anesthetic patient. Other causes of lung abscess include local causes like bronchial obstruction and impaired drainage of the secretion leading to stasis and secondary infection, like what occur in bronchogenic carcinoma, which may occur in one of the main bronchus or the large bronchi, leading to obstruction of the remaining lung tissue behind the obstructed tumor, leading to stasis and infection. Please check in old age the possibility of lung abscess due to the presence of bronchogenic carcinoma. Okay, foreign body which may occur obstructing lower bronchus, leading to distal obstruction of the airway behind it, leading to resorptive or atelectasis of the lung, collapse of the lung, may lead to lung abscess as well. Severe cases of chronic bronchitis also lead to lung abscess formation. What about necrotizing or suppurative infection, like necrotizing pneumonia, bronchiectasis, and fungal infection? Okay. Systemic causes of lung abscess like septic embolism, septic thrombophlebitis, or infective endocarditis in right side heart lesions, leading to arrest of these septic emboli in the lung, causing lung abscess, bacteremia and pyemia, which are presence of circulating pyemia is presence of circulating emboli carrying infection, which called septic emboli, which will arrest in the organ like lung, forming multiple small pinhead-sized abscesses along the cut section and the outer surface of the lung, causing disseminated pyogenic infection, which usually small and multiple. Lung abscess grossly, location and number of lung abscess depending on the mode of development and the cause of lung abscess. If the lung abscess is due to aspiration abscess, it will be single and mostly in the right side, and if associated with bronchiectasis, usually the abscess is multiple abscesses and basal, bilateral, and if it is caused by septic emboli, it will be multiple, small, discrete, and pinhead-sized all over the lung tissue. Okay, that case is due to lung abscess complicating what's called bronchopneumonia due to the yellowish. Grossly lung abscess may be single cavity having thin wall lined by irregular necrotic lung tissue with a purulent suppurative exudate, or may be multiple cavities filled with pus like in the case on the right side. Under microscope, lung abscess showing that thick surrounding membrane, which is called the pyogenic membrane, formed of septic granulation, and the cavity of the abscess containing suppurative or purulent exudate formed mostly of dead neutrophils, which are called pus cells, and the surrounding lung tissue showing that spaces which are called compensatory changes in the surrounding lung tissue. Now, what are the clinical picture of that lung abscess? Lung abscess is an infective lesion of the lung, leading to cough, expectoration of foul-smelling sputum, hemoptysis, spiking fever, weight loss, and weight loss occur not in acute lung abscess, occur on long-standing disease like chronic lung abscess. Also, chronic lung abscess may lead to secondary amyloidosis and the clumping of fingers. And now don't forget to check the presence of any underlying tumor like bronchogenic carcinoma, which may be the hidden cause of that lung abscess occur in old age. And thank you.